Women tell me, why has Brazilian butt lift, otherwise known as BBL, become so popular? It has gone from a couple of thousands of surgeries, as in 2019, to 100,000 of surgeries 5 years later. It has become such a popular trend, no one actually hides the fact that they do BBLs anymore. You can see them on TikTok, Instagram, showing off their latest butt, doing vlogs, walking from the airport to the hotel, from the hotel to the consulting room, from the consulting room to the theatre, from the theatre back to the home, where they line on the front for like 1 to 2 months because they're not allowed to sit on the butt. BBL, as you know, involves removal of your fat from parts of your body, such as your abdomen, your lower back, your thighs and hips. This fat is then extracted and purified and then injected into your buttocks. Now, it is advisable that this fat should be injected not into the deep muscle layers where you've got your blood vessels and your structures such as your nerves, but it should be injected just behind the skin where this subcutaneous layer is, because this is where you have less risk of complications that can lead to death. Now, women will tend to go to the cheapest places where they can get this BBL, but this is not advisable because you're paying what you get for. And if there's any complications, then there is simply no aftercare plan. So cheapest countries include Turkey, Mexico, Finland, Hungary, whereas in the UK and the USA, having a BBL surgery done is relatively quite expensive and can cost you anything between £6,000 in the UK to as much as £12,000, while in the US it can cost you again maybe $6,000 to as much as $18,000. So it is quite expensive, but however, you're paying for not just the surgery itself, you're paying for the expertise, you're paying for the staff, you're paying for the aftercare plan in case anything else goes wrong. Now, as you know, in the past people would usually do silicone implants, but that has now been superseded by BBLs because BBLs is thought to be more natural because you're using your own body's fat, while with silicone implants, you're using silicone. Can't say that one procedure is more dangerous than the other, but if silicone is done in the wrong place, maybe a black market clinic, you could have body poisoning where the silicone is leaking into your system and you're basically feeling very unwell. Sometimes the silicone can get quite attached with the structures in your buttocks that it can be quite impossible to even remove the silicone without permanent scarring to the buttocks area. BBL, as you know, is very, very risky. Obviously, the common risk of surgery can include bleeding, infection, numbness, reaction to the anesthesia. However, with BBL, there's always a risk that you can get fat embolisation, where the fat blocks the blood vessel and that can lead to blood clot in the lungs, known as pulmonary emboli. You can also get fat necrosis, where at least 50% of the injected fat dies off and you get these hard lumpy scars, you get these oily cysts, you get deformity of your contour, known as contour deformity, and this can lead to a lopsided shape of your BBL. In addition to that, you get hypertrophic scarring, you get permanent numbness, you can get recurrent skin infections like skin abscesses, cellulitis, and you find yourself needing to take antibiotics all the time. If you do consider going for BBL, make sure that you check the qualifications of the surgeon, make sure that they are board certified, look at before and after pictures, check for the reviews, maybe speak to people in person, someone who's actually had a procedure with that same surgeon. If you're going abroad, I would advise you to travel abroad, go and speak to the surgeon in person. Don't look at the online stuff because the online stuff can be doctored. We've got AI now. It's almost like looking at a house. A house looks very good when you look at it in pictures, but when you go in real life, the house is not what it seems. Similarly, have a look at the center. Is it an accredited facility? Does it have, defibrillators in case everything goes wrong? Look at the staff, are they qualified? And go with someone who's maybe done it before, or go with a health professional who knows what they're talking about, who can give you advice and opinion. But a BBL as a whole is not a medical procedure, it's not a life or death, but it can become life or death if you have the surgery done in the wrong hands. So I hope you enjoyed this video. Please feel free to share, like and subscribe.